substance abuse in Turkey. Good afternoon, ladies and gentlemen. Substance abuse is a problem in Turkey, but of course in Turkey there are different comprehensions towards this matter. Of course, interventions in Turkey are actually things which should be described based on the structural differences stemming up from the history. So based on what data do we explain the substance abuse in Turkey? This is what I'm going to talk about first. The first and second national policy and action plan prepared for this purpose is going to be a basic resource for me. Between 2006 and 2012, the first national policy and strategy document was prepared, and then a research committee was established. Therefore, combating demand and supply was put more on the foreground in this document. Of course, these were then collected as data, and generally the problems were discussed and established, and then a series of actions and measures were formed. So I'm going to talk about all those with you now. Of course, when we talk about substance abuse, different types of data are being used to approach the issue. The rate of substance abuse, the data of TÜBİM, the treatment status, and the data set of probation, also prison data and the number of convicts in prison are the types of data that we're using while evaluating the substance abuse problem in Turkey. Unfortunately, the most important problem in Turkey is about measuring the level of substance use in Turkey. The trials carried out are important. They exist, but they're all based on different samplings. They're carried out in different years, and the survey contents are different, so comparable data are not available, unfortunately. SPOT is applied in Europe, and in every 4 years, comparative data are being revealed there. For the first time, Turkish Drug Abuse Monitoring Center has come up with the most comprehensive study in Turkey with different categories of age. But before that, similar age groups and similar categories were not subjected to such studies, unfortunately. But in the evaluation of 2011, the rate was found to be 2.9% between the ages of 15 and 24. This is any substance, by the way. The discussion is going on because if the questions were asked by mentioning specific substances, maybe those youngsters could have been guided towards substance abuse. This was the first reservation. This is the reason why the first studies were carried out without mentioning the specific names. When you look at the treatment services, you see that the substance abuse rates per year, both inpatient and outpatient services, have increased with every year. Of course, I'm going to talk about the problem in this area as well, but simply let me make an explanation like that. In 2011, more than 155 people have received inpatient service, but only 22 treatment services were available in Turkey then, and only 11 of those could give that healthy data. In fact, this data, under normal conditions, if the coordination was there and there was an efficient collection of data, could have been much higher. But at the end of the day, when you look at the increase rates, you see that substance abuse problem has actually increased if this is used as the framework. Probation services are being carried out within the scope of Ministry of Justice in Turkey as per law number 191 of the Turkish Constitution. If you're using or carrying a substance with you, you are subject to imprisonment. But since most of those people are young, and since they're going to have a very bad record after leaving the prison, those youngsters will not be able to survive and get a job, and we do not want them to start selling those substances. And this is the reason why the probation law was issued in Turkey as of 2011. If there is need, the person is going to be treated, and when the treatment is over, the same person is going to continue with the therapeutic process for 1 year, and this person is going to be subject to urine test in every 2 weeks. And in that 1 year period, if it is proven that the person is not using a substance, then nothing happens, and the person simply continues with a normal life. In 2012, from 2012 until today, we see that more than 200 people have benefited from the service of probation. In 2005, the Turkish Penal Code was amended. Therefore, the amount of data has significantly increased. But we shouldn't forget that 95% of those who are in prison because of drug abuse are actually the sellers. The users are outside the prison. But this, of course, has its own serious consequences. Consequences such as this: if a person is subject to probation according to law, and if the person does not abide by the law, and if the person is caught for the second time, and the reports sent to the court in every 3 years report that this person is not abiding by the rules of probation, then there is a punishment to be given. But sometimes people can be subject to probation for 50 years, which means the police catches the same person because of substance abuse for 50 times, but since it is not subject to probation, another court guides the same person to another probation once again. So this is a repetitive punishment. Between 1980 and 1996, the substance abuse was considered to be a security issue, and the police organization in the cities and gendarmerie in sub-county levels started combating this issue in order to eradicate the problem. In 1983, AMATEM, Alcohol and Drug Abuse Treatment Center, was established, and in 1996, for the first time, combating demand was also involved in the process, together with combating supply of drugs and substances. So many different organizations were involved in the process. And then there was a new center for acting as an umbrella organization. The Ministry of Family Affairs were given this duty, and as the national contact point, this organization was appointed. Then the representatives from EMCDDA came to Turkey to visit our country for the same purpose, and this center was then decided not to be in this structure, and it was decided that that ministry would not be able to carry out the work. And of course, the same efforts was being carried out in the other countries of the world. Therefore, the Department of Smuggling and Financial Affairs was chosen as the umbrella organization for monitoring substance abuse. So this organization is now reporting to EMCDDA, and the same organization is in charge of monitoring the process, and also the organization is carrying out preventive plans and actions for the same purpose. Since this is an international contact point, the EMCDDA, the national drug policy and strategy documents in Turkey were issued in 2008 as the first document on this matter. And then in 2008, Turkish National Grand Assembly has come up with a research committee where they discussed all those matters and made the related decisions. In 2013, with the signature of our Prime Minister, the second strategy document for combating the problem was signed, and the National Drug Policy and Strategy document led into the establishment of coordination centers under the umbrella of various governorships in Turkey. So what kind of positive developments took place in Turkey? The first positive development can be regarded as the determination of corporate liabilities in the field of prevention, which means substance abuse problem was being defined as a social problem until then, but nobody knew what the Ministry of National Education had to do. Nobody knew what the Ministry of Family and Social Policies had to do, or the Higher Board of Religious Affairs had to do. Different vocational organizations had to be involved in the process. There were shortcomings about that, and social consciousness was not there. Therefore, we first tried to increase the level of social awareness. Of course, the preventive activities had to be done. It was the first finding for us. As mentioned in all reports, Turkey is actually setting an example in terms of combating supply for the other countries. But when it comes to prevention, unfortunately, we cannot talk about the same success. When you talk about the progress reports of 2008 and 2007, you see that Turkey's combat against supply is being praised, but the prevention area is unfortunately lacking. So the most important thing is the existence of NGOs and the activities to be performed by the NGOs. Together with the first strategy document, the first series of activities were initiated. The NGOs were provided with support in order to be a part of this combat. The first national data activities of TÜBİM took place together with RTÜK, Higher Board of broadcasting agencies. The efforts were initiated to inform the media on the subject, and then probation centers' efficacy level was increased. However, there were some deficiencies in the field, such as the institutional arrangements and the coordination problems. Lack of coordination between institutions caused inability to develop projects. The projects developed were not supported by other organizations, and that was a very big problem. Of course, in order to prevent substance use, different projects have to be developed for different mass audiences. But research-based activities should also be there. If you don't do that, you cannot understand and realize which project has to be used for which group of people. And this prevents substance abuse and combat against substance abuse, unfortunately. In 2013, the number of AMATEMs has increased to 23. And the number of beds has exceeded 600, but it is still falling short because these expert personnel is a problem. We unfortunately did not have enough specialist professionals. And rehabilitation was not mentioned at all in the report published then. Only the treatment process was mentioned as a way to get rid of this problem. As I said before, Turkish Grand National Assembly has established a research committee, and those areas falling short were equipped with institutional organizations, and it was stated that this is not something that you can get rid of by single efforts of single organizations. And what was emphasized was that we needed a community-based support. For example, you talk about probation, but if somebody is making use of probation for consecutive times, the person probably does not conceive this as a crime, and it makes people think that they can use the drug again. And you see in the last couple of years, many people growing the related plants are being caught. But if you're planting cannabis, you have to be imprisoned between 1 to 7 years. But since the minimum imprisonment period is 1 year, the people who are growing those plants on the lands are usually imprisoned for 1 year. So this minimum limit threshold should be increased, and this is important to carry out legal activities to enable that. The children and adolescents policy on this matter should also be designed. Together with this report, for the first time, school-based preventive activities were initiated in the United States and America. And in the United States and Europe, many initiatives have been taken to prevent this from happening, and we are now in an effort to do the same thing in Turkey. Of course, activities of the NGOs should be provided with a new structure, and a model should be created about prevention. And this is what the report says, and of course it says that responsibility belongs to Ministry of Health. Rehabilitation requirement is also emphasized in this document officially. This is the only place where this is being emphasized officially, but you cannot open up a rehabilitation center in Turkey on official basis because there is no legislation which provides for this. Let's say there's a sampling you can make use of in Gaziantep, but they cannot set up a rehabilitation center. It has to be opened under the name of youth center. So basic legislative problems are more on the foreground these days. And as we mentioned before, whether it be AMATEMs or probation directorates or prisons, it doesn't matter. Since they're not using their data properly, we cannot see where the substance abuse is heading towards in Turkey. This is the reason why we have difficulties in our combat against the problem. 2013-2018 second national drug policy and strategy document was published, and efficient combat was underlined. The activities are underway for the time being. In 2008 report, particularly, a general directorate under the umbrella of Prime Ministry was emphasized, and it was stated that experts from different organizations had to be sitting in that committee. There are examples like this in the United States or in different countries of Europe. You have to do the coordination on one hand, but on the other hand, if you are an organization, you cannot establish coordination between different organizations. You must be a supra-organizational structure. So this is the reason why you have to be a part of an organization like that. So the Prime Ministry is now in an effort to come up with such a supra-organization. The report issued in the following years was putting the emphasis on carrying out a more efficient struggle against the problem, like a hotline to be used for the young people in Turkey, and also opening up new rehabilitation centers. Let's say the rehabilitation services were given, the treatment was given, but still it is not enough. You have to have a social integration, and you have to open up new centers to enable that, which means you need to have structures in place. For example, visual or audio materials for different groups of population should be prepared. Those materials should be taught by teachers at schools, and those should be subject matters of elective courses. And at one point, at one point of this line, we have the teachers, and at the other point we have the students. So they should all be provided with awareness on this matter, and awareness integration of different centers should be provided. Primary healthcare should also be strengthened with those activities, because this is how the families will be provided with more awareness on the same matter. And 24/7 expert knowledge and information line or a hotline is necessary. Of course, general population and young people surveys are also required. Research for social needs of the addicts is required. A final and the first test is a must in order to understand what kind of a change has been achieved on that population. And measures against children living or working on the streets are also important for our country. Media-based prevention practices also make up an important component of this effort. Training of media and structuring of the media is now more on the foreground. One of the most important factors is activities which are based on treatments. Of course, the improvement of the physical facilities and number of staff in treatment centers is a must for this. Making need analysis and opening treatment centers within public institutions is another prerequisite. Privileged treatment centers for children and adolescent addicts with special physical configuration is required, because we do not have different places where different services are provided for different age groups. And there has to be a standardization in this sense. This is another activity that is underway for the time being. Of course, the experts should be convinced and encouraged to work in this area. Therefore, the code of substance abuse treatment centers should be revised, and the activity is underway. Promotion of health personnel in this field is going on to understand who is going to apply what and what kind of actions should be made or taken to prevent misuse. People in Amatem were reported to be using the urine samples of other people instead of their own urine samples a couple of years ago, so that's a problem that we want to get rid of. In Europe, there are places where the same thing is being done, but sometimes those above the age of 18 are not obliged or cannot be obliged to be a part of such a rehabilitation in Europe, and we're still discussing the same thing in Turkey. Rehabilitation and social integrity-based activities, and especially activities to provide those people with professions are also underway. İşkur, the organization for finding jobs in Turkey, is also taking important steps to enable that. Your last 3 minutes, sir, in order to allocate more time for questions. Well, as I said before, the activities are underway, but generally speaking, or to sum up, we can say that what is really needs to be emphasized, is that our infrastructure problems are continuing. Institution-based, specialist-based problems are continuing. We do not have enough personnel who are going to be involved in preventive activities. Treatment is important, but prevention is also very important. So social workers to work in the prevention area are unfortunately missing. The training programs at the university level also plays an important role. Increasing governmental and public awareness of drug problem and promote discussions in the media about substance use are other important factors. And in order for this combat to be carried out successfully, the NGOs have an important role to assume. Therefore, NGOs and support to provide for the NGOs are the other important factors for the entire issue. Thank you very much. We have time for 1 or 2.